Hi, everyone. Thank you for joining us. My name is Liz Perchia. I'm the Communications Director at the Center for Climate, Health, and the Global Environment at Harvard T.H. Chan School of Public Health. Today, we are hosting a panel event with the FXB Center for Health and Human Rights at Harvard on the key takeaways for climate and health from COP27, the annual UN Climate Conference. We are joined by our climate change and human health fellows who were on the ground in Sharm El Sheikh. Our webinar is moderated by Dr. Ari Benstein, the interim director of our center, Harvard Chan Sea Change. After our conversation, we will open it up for questions from attendees. If you have any questions, please enter it in the Q&A box and we will try to get to as many as possible. There will be a recording of the call we can share with everyone afterwards. And with that, I will pass it over to Dr. Benstein. Thank you.
Thank you so much, Liz. Welcome, everyone. Delighted to have you with us. We have three superb individuals to give us some on-the-ground insights as to the ongoings at COP27, particularly with, of course, a health focus. Joining us in no particular order are Doctors Kimberly Humphrey, Tess Wiskel, and Caleb Dresser, all of whom are emergency medicine physicians. We're going to chat for a little bit about their perspectives on the COP. And then, as Liz mentioned, we will open up for questions. Please do put your questions into the Q&A feature, and that will help us make sure we get to them. So to start with, I just want to take a high-level, quick opening round question, or give one to you all, which is, how would you describe your mood coming out of the meeting? And that's really to give a sense of, what do you think about the prospects for protecting our planet and our health, given what you saw? And then once you choose your one, I'll ask you to sort of give a one word and then give us some rationale as to where you came to that. So Dr. Humphrey, if it's okay, we'll start with you.
Yes, certainly. Thank you, Harry. So my word would be cautious. This really was a COP where there was a lot of discussion. We really were thinking about the impacts that we're seeing now. So it's no longer theoretical. We know that our planet is changing. We are seeing that every day, and we're seeing the impacts on the health of our communities every day. So we did see a commitment to a loss and damage fund, which is excellent, to address the costs we're already seeing, particularly in developing countries. The reason I use the word cautious is what we didn't see was increased ambition for mitigation and a commitment to a total phase out of fossil fuels. So we're still on track to hit about 2.7 degrees of warming, which will be catastrophic for our planet. And it would have been wonderful to see more ambition on mitigation. It's something that we absolutely have to have.
Thank you, Dr. Humphrey. Dr. Wiskel, your impressions.
For one word, I'm actually going to pick two, which is hopeful, but guarded. And I think hopeful for some of the same reasons Dr. Humphrey said, which is that we were actually able to focus on vulnerable communities and realize the impacts that climate change is having now on these vulnerable communities, and have countries come together to create this loss and damage fund. And guarded in the sense that we did not do enough, I think, to address mitigation of fossil fuels and what we really need to do to mitigate having all of these damages in the first place.
Thank you. Thank you, Dr. Wiskel. And Dr. Dresser.
Thank you, Ari. So I think it's really interesting listening to both Dr. Wiskel and Dr. Humphrey as they speak. Both of them used my word a number of times, which is impacts. And if I were going to take one theme out of this COP, this was a COP where that was at the forefront of the conversation. This was happening in the wake of flooding in Pakistan that displaced many, many people and had enormous impacts on health. And it's coming on the tail of a number of other climate-related disasters with impacts on health and the healthcare system. And so I think the conversation at COP was very much influenced by a sense that impacts are real and are happening and are something we need to deal with. And I think that's part of what led us to this really, in some ways, surprising and hopeful alignment on loss and damage. But also, I think impacts needs to be reflected on in terms of the policies coming out of COP. What impacts will they actually have in terms of drawing down carbon emissions? And as both of my colleagues alluded to, I think we continue to have a lot of work to do in advocating for those policies going forward.
Thank you, Dr. Esser. Thanks to each of you. So I heard cautious, hopeful and guarded, and impact. And so now I want to try and get a little bit behind the headlines, because anyone who's here can certainly read the news, but you three were on the ground. And I want to see if we can maybe take those words and those ideas behind them and put them in the context of what you saw. And all three of you alluded to one, I think, potentially, transformative piece of this COP was really focused on how this is already happening. So how did you see health playing into that? Was this a story about impacts to polar bears and glaciers, or was this a story about impacts to people? And let me start, Dr. Wiskel, with you. What was your sense of how health played out on the ground in the conversations you had and what you saw?
I think that there was a tremendous input from the health community in general, from being able to organize protests that showed how the impacts of climate change are impacting our health right now and impacting lives, to hearing stories from people and how this is impacting the areas they're in. So some of the most really moving stories were from groups of vulnerable communities, Indigenous women, people that were being affected now, and how they brought those stories forward, from everything from the floods in Pakistan to the droughts in the Horn of Africa, and how we were really having a human effect now and bringing those stories in. And there was a lot of events around health, not only just in the WHO Pavilion, but outside of that. And that voice really got heard, I believe, at this COP.
Thanks, Dr. Wiskel. Dr. Humphrey, was that your experience? Did you hear that health voice coming through? Do you think it got to where it needed to go?
That's such a question. No, I don't think it got where it needs to go, but that's because I'm overly ambitious. I think we're only in the second year of the COP Health Program. So COP26 was the launch of the health program. And given that, I think we've come a remarkably long way. I did find, and I have a somewhat unique experience as an Australian who is currently living in the US, being able to experience both worlds really at COP. And I did find in my interactions in some other areas within COP that there wasn't so much of a health voice, or that the health voice wasn't seen to be as relevant as it was in some of my discussions, particularly with my colleagues from the US. Another thing that I would emphasize as well, and I think Tess touched on this and it's really important, is the voice of those who are from the Global South in regards to their health and the impacts. What we don't need is for people to hear those of us from the Global North talking about those people. One of the unfortunate realities for COP is the people who can go are the people who can afford to go. And certainly it means that there are many people who are still not represented in those conversations, and therefore are being spoken about or for by other people such as us, which is something that is unfortunate as well.
Thank you, Dr. Humphrey. So I think you raised the key issue of, yes, there are people who are raising important concerns to human welfare and health, but maybe not in proportion to the populations affected because of the barriers to access to something like COP. And I want to turn to you now, Dr. Dresser, to also give your reflections on how you heard health coming out, and maybe get your sense of Dr. Humphrey's point around, did you see that same maybe disproportionate availability of the COP to people who might be having real time? You already alluded to what's going on in Pakistan and other places.
Yeah, absolutely. I think there's no question that there is an issue of representativeness in terms of who is in the room or in the conference. And that's certainly something that I think needs to be addressed. I think it's very important that people be able to speak to their lived experience with impacts from climate change. Those are some of the most powerful voices, I think, to influence policy. I will also say that the context of this particular COP was very interesting as a backdrop for conversations about the health impacts of climate change. This, just to set the stage, this was a COP that was held largely in air-conditioned tents in the desert. It was very hot outside. It was very sunny every day. There was a little bit of an urban heat island effect going on because a lot of the outdoor floors were black and were absorbing heat, and there was very little shade. And so I think a lot of the delegations from all over the world were facing what's it like to try to have a conference in a very hot climate in essentially uninsulated air-conditioned tents with large air conditioning units running. And so that was a backdrop that when you start talking with a policymaker or somebody in the advocacy community about what climate change means for health? Well, it's pretty obvious. It's all around you at the conference. Heat is a big issue. It's going to be a huge issue in many parts of the world in the years to come. And for those in the health community and the public health community, is a real area of concern. And so I think that context for this particular COP was probably a helpful subtext for making this feel very real. And I think that may have influenced how some people thought about it.
So that's a really interesting point, Dr. Dresser, this sort of reality of climate change bearing upon the conference, and also to the extent of the air conditioning load. And I'm guessing that air conditioning was probably fueled not with renewables, but with fossil fuels, just to make this meeting possible. I just want to take that point, Dr. Dresser, and give a chance for Drs. Wiskel and Humphrey to address. Were there things that you saw on the ground that you thought were sort of noteworthy that might not have been visible to those who weren't on the ground, that maybe was a part of, like what Dr. Dresser said, sort of how it was structured, or folks that you saw there that you were really surprised to see there, or folks who you're like, where are these people ought to be here, but they're not here? Any observations, notes? I'll start with you, Dr. Humphrey.
Absolutely. One thing that was, I guess there's a couple of things that jump out to me from that question. Number one is, we know that there are about 660 fossil fuel lobbyists who are present at the conference, and they weren't necessarily immediately visible, but there was evidence around, and I think particularly with some of the pavilions where certain countries had very big, flashy, well-conditioned, brightly lit pavilions, and some of the smaller developing nations had really very small sort of side pavilions as well. And so there was that definite undercurrent to the COP as well, which I think wasn't certainly not visible if you weren't there, but really required us to have a bit of a think about what's actually happening behind the scenes. I think in regards to representation, it was excellent to see a significant number of senior governmental climate and health leaders from the US who were present at COP, which was fantastic. Certainly wasn't true for the delegations of all countries. So variable whether there was senior government leadership from some countries, but certainly not health leadership from some countries as well, which I think speaks to the need to still really emphasize that health voice is relevant when we're talking about climate change. It certainly isn't accepted everywhere.
Great. So those are some interesting on the ground notes. Thank you, Dr. Humphrey. Dr. Wiskel, any from you?
I would echo Dr. Humphrey, and just walking in and walking around the COP, something that you don't get from the media reports are the disparities between these pavilions and who kind of probably could pay for what. And seeing the UAE pavilion next to Niger's and the difference in sizes and substance within them. And then you can see the different communities coming together. And I think, like I said before, some of the most impactful voices were the indigenous groups, and you could see people dressed proudly in their local attire. And I think they were able to speak to their experiences, and those were really impactful voices. The other thing you could really feel is going by the youth pavilion. You can see the energy emanating from them, and they brought that energy to other events too, and to what they wanted to see done. And really, like we were talking before, the impacts of climate change on their communities and what's happening now. And those were some of the really powerful voices that came out of this COP.
So I love the reality that you're bringing to this event, which otherwise gets digested into headlines that don't give the personal stories. And I think being on the ground does that. And so that's the next question I want to pose. Were there individual conversations? What are some of the conversations you had that really stood out to you during your time there? And that may get into your, the particular roles you all had, because I think it's important for everyone here to know that you weren't all just walking around looking at the event. You all actively participated. So it'd be great to hear about, your roles and conversations you had and how they helped inform your understanding of what this COP was about. And I think, Dr. Dresser, it's your turn to go first.
Sure, thank you. I think we in the health community, whether you are a physician or a healthcare administrator or any other role in health or public health, we are seeing how people are affected. And we have a lot to think about in our industry and in our professional responsibilities about what climate change means for our patients or the populations that we help care for. And I think part of that means talking to people in leadership roles about these impacts and educating them about that. And so I was pleasantly surprised during this COP. I had interactions with a number of people who are either politicians or policymakers within the US government to simply provide our perspective as physicians that this is impacting our patients, and we need a plan for keeping people safe and reducing carbon emissions. And those conversations, at least with the individuals I interacted with, they already knew a little bit of what I was talking about. And that was really heartwarming to speak with a state senator from California who said, yes, we are aware of smoke impacts and air quality issues that are affecting health in our region, and we really want to develop good policies around this. So I think there are notes of hope. I think providing perspectives from the healthcare community is really important, and we all need to keep doing that. And I at least came away from this COP hopeful that that messaging has been landing and that people are interested in crafting policy to address it.
Thank you, Dr. Dresser. Dr. Wiskel, tell us a little bit about your engagements at COP, the venues you went to, maybe some of the conversations you had, and how that led to your understanding of what this COP is all about.
So I had the opportunity to participate in a panel talking about the social determinants of health and how climate change is affecting these. And I think one of the big things I took from the panel was that I was there as an emergency physician, but I was sitting next to an engineer from Kenya, a researcher from the US that's doing education work. And I was speaking with people from countries around the world. And I think one of the big things COP allows us to do is get outside of our silos of health, engineering, of education, and come together, because the solutions to climate change cannot be from just one sector. They need to be from everyone. And having those conversations and those new connections and ways to work together, I think is one of the things I'm going to be taking out of COP. And outside of just this panel that I was speaking with others on, that happened kind of everywhere we went and with everyone we were talking to. And that's something that is really important about having such a huge conference. And we can talk about all of the issues of having a huge conference like this. But one of the things it does do is bring people together.
Yeah. And I think the estimates, we're talking tens of thousands of people for those who are not as familiar with COP, but it's a large crowd. Dr. Humphrey, I'll give you the same question. Tell us about your individual role at COP and the conversations you had and how that played out in your thinking.
Absolutely. So like Dr. Dresser and Dr. Wiskel, I had many of the same kind of conversations around the approaches that we need to have to address climate change and health, and that they're not easy, and that it's a complex problem and it requires multiple sectors. So we're looking, for example, at heat-related illness. That requires a lot of different actors in this space and stakeholders to come together to act for communities, particular communities of vulnerable people, lower socioeconomic class, those with disabilities, those with complex medical conditions. It's not just a health problem, although health is a critical part of the conversation, and it requires all of us to work together. So it was very encouraging, I think, as someone who has previously had conversations where health has been dismissed as being kind of fluffy and not relevant and not having significant financial impacts or anything that's exciting to economists, to really see our health voice legitimized and to see that we are a really important part of the conversation, and also to see a great future for collaborations to work together to solve some of these problems as well. So really encouraging. And as Dr. Wiskel said, being able to connect to people from all over the world to form those collaborations that will stretch across continents was absolutely phenomenal and a very valuable part of our attendance there.
Great. So let's move now from your personal experience to some of the big news that came out of COP, specifically related to your work as medical providers. Many of those who are participating in this session know that there was a major commitment coming out of the U.S. Department of Health and Human Services to collaborate with the National Health Service of England to essentially align procurement requirements to accelerate decarbonization of healthcare supply chains, which is a major driver of greenhouse gas emissions. The United States, somewhere around 8.5% of all the national greenhouse gases are thought to come from healthcare, with the largest source being embedded in our supply chain. So what was each of your sense about this commitment? Was it something that landed within the health conversation? Did it extend beyond? Do you think that this is the kind of work that really was an important, is is this one of the things you think was really the most important one of the most important outcomes related to health at COP, or potentially maybe others? I'll start with Dr. Wiskel.
So when I first heard this announcement, it was at the US Center. So I think it brought in other people outside of health to answer that question, that where other people are seeing how the health sector is leading in this mitigation effort. And I think that's a really important thing to take into account, that we're seeing the impacts, but we're also leading in mitigation. And there was a lot of excitement, I think, from health and outside. And there was a lot of excitement from what the kind of US goals were, and what Biden brought when he was speaking, and what this new pledge for decarbonization was bringing as well. And there were a number of other events too around Attach and other initiatives about decarbonizing healthcare and building resilient healthcare systems. And I think there was a lot of excitement around the community from this.
Yep. Dr. Dresser, your thoughts on the plans to decarbonize our supply chains?
Yeah, I mean, I think we're all hearing the term supply chains more in the last couple of years than we did for the whole previous part of our lives, unless you're in economics. And I think it's a really important thing for us to be learning about, because as a healthcare system, this is a huge piece of our carbon emissions. And I think the solutions to this have to be large scale. If we are trying to do this piecemeal at the level of institutions, it's going to be very challenging. If we are doing this at a systems level, the economy of scale will make this a much more feasible approach. So I think that's really good. I would also add that the bigger picture context of announcements from US Department of Health and Human Services at COP is worth thinking about for all of us in the health community. At COP26 last year in Glasgow, we heard about commitments to move toward a net zero healthcare system, including for the VA. And, you know, the result of that a few months later is that you have a number of healthcare systems, including the hospital I work at, Beth Israel Deaconess Medical Center, that have signed on with a White House pledge to move toward net zero by 2050. And so I think announcements coming out of COP can translate into important action at the national and subnational level within various industries, including healthcare in this case. And as we look ahead, if this is the type of announcement we are getting now, I think all of us in healthcare should be thinking about how are we going to comply with future incentives or perhaps directives that move healthcare toward a decarbonized and adapted to climate impacts future.
Thank you, Dr. Dresser. And Dr. Humphrey, your thoughts on that announcement, whether there might have been other announcements that weren't as prominent, but you thought were really important?
Absolutely. So I was really quite thrilled to hear that announcement. I think a couple of things. Sometimes we do hear discussion of the role of healthcare emissions not being as big as the other emissions within countries. And I think we all appreciate how important it is actually to act on that. If we put all of the carbon emissions of healthcare systems worldwide together, it would be the 5th largest country in terms of carbon emissions. So it is actually a critical sector for us to work on. Also, we often hear the discussions around mitigation in the healthcare sector around things like all electric builds for hospitals and those bigger infrastructure decisions. But as you pointed out, our Scope 3 emissions, our procurement, our supply chains are a significant contributor to carbon emissions as well. So to see this announcement really committing to act on that was just absolutely fantastic. And I think we all know the great work the NHS has done in this regard. The US has particular challenges given it's not a publicly run national hospital system, and the nature of that system makes it more difficult in many ways to achieve these goals. So finding a way such as this to create this ambition is just amazing. And to your point, Dr. Dresser, I think setting the tone is also critical. I've heard a lot of discussion in my Australian climate and health circles around this announcement and demands to the senior health leadership in Australia to join in this partnership as well. So I think it really can't be underestimated how important this is.
So we've taken some time now to think about the healthcare contribution to climate change and the actions at COP that relate to that. Let's take one step further out and focus on the conversation that Dr. Wiskel mentioned in her opening remarks, which was, and Dr. Humphrey actually mentioned as well, that there was relatively more attention, arguably at this COP, to resilience, and then there was to mitigation. And many of you will know that there was a conversation around a pledge to essentially phase out fossil fuels, which was not incorporated into the final language. Do you agree, as some people have asserted, that this is a real shortcoming, that in fact this was actually a really important piece to have in place, or maybe there's another way that you would look at it, and potentially a silver lining, or maybe even some other conversations that you heard about that were compelling on the mitigation front? Dr. Humphrey.
Absolutely. And I'm sure my colleagues may have a different spin on this, but I'm really terrified is probably the right word. I mean, it is nearly 2023. We are running out of time. We need to see significant ambition on mitigation. I am very passionate about adaptation. That's a big focus of my work here at Harvard. However, if we do not address our carbon emissions, there is a point beyond which we cannot adapt. In terms of the loss and damage discussion, we already know where we are now. By 2050, that fund will need $1 trillion to provide for developing countries. If we don't do something to curb our carbon emissions, and no country has a pledge or commitments that are sufficient to meet 1.5 at the moment, then there is no amount of money in the world that can address this. So I am really concerned. I guess my small hint of optimism would be that a year ago, I think it would have been fair to say that most of us could not have foreseen that there would be a commitment to loss and damage this COP. And so I'm hoping against hope that next year we will see for mitigation what we have seen for adaptation and addressing loss and damage in this COP.
Thank you, Dr. Humphrey. Dr. Wiskel.
I unfortunately agree with Dr. Humphrey. This is not where we need to be with mitigation. And I think it's something we can compare to treating our patients, where we can treat the symptoms, but if we're not treating the cause of the disease, we're not doing enough. And we're treating the symptoms by making this loss and damage fund, by thinking about adaptation, but without actually looking at the cause, without more of a commitment to actually phase out fossil fuels instead of just speaking about coal. We really are not doing enough now, and we don't have a chance to do this in the future. We need to take bigger actions now.
Thank you, Dr. Wiskel. Dr. Dresser, you want to add your thoughts on that point?
So I echo the concern. I would spin this a little bit differently. I would say that aligning almost 200 countries around anything is really challenging. And I think it is inspiring that we have achieved some alignment around loss and damage this year. Last year, there was alignment around a different set of things, more focused on mitigation at Glasgow, and in Paris in 2015, there was alignment focused largely on mitigation. And so what I would say is, yes, I would like to see more aggressive commitments. I would like to see a commitment to eliminate fossil fuels, but things are moving in the right direction. If you look at the trajectory we seem to be on compared to where we thought we were going to be at 10 years ago, things are looking a little bit better. There have been huge advances in solar panel technology. There are bills happening in large countries, including the United States, that are going to incentivize a whole lot of renewable energy infrastructure. And it will take some time for that to come online, but it will matter. And I would also add that when we look at mitigation, every 1/10 of a degree matters. And so the difference between a 2.2 world and a 2.1 world, that's a big deal. That's a lot of lives saved. That's a lot of hospitalizations that don't have to happen. And so every step towards mitigation is helpful. I think it would have been nice to see more this year, but there is also next year to work on that. And we did get something big this year that we did not have before, which was commitments to a fund around loss and damage. And I would also add some other commitments around, for example, creation of the Santiago network for technical assistance for impacts from climate change in the global south, and other sort of loss and damage related instruments, including the Global Shield program.
Thank you each for entertaining my questions. I am happy to report that we have several questions coming in through Zoom. And as a moderator, it's nice to see that these questions are reflecting people paying pretty good attention, excellent attention to the conversation. And I'll start putting some of them forward. We have one from Sheila Lynch Afro, and forgive me if I'm mispronouncing her name, but it's an excellent question. And the question is, what should HHS or CMS be doing to spur health facilities to reduce greenhouse gas emissions beside voluntary a voluntary climate pledge should Medicare or Medicaid reimbursement be affected? I will let you decide if there's someone who wants to dive in, and if not, I can choose.
I mean, I think that's a great point. I'll just echo what she said of like changing reimbursements and tying that into greenhouse gas emissions. And in particular, the scope 3 emissions are going to be able to move forward. That's going to move our healthcare systems forward, and it's going to move them faster than it would if it was just voluntary pledges. I think that's one great way to think about it.
Dr. Dresser, you look like you might want to chime in on that one.
Yeah, I would agree. I mean, I think pledges are the first step. I think there is a combination of institutional and political will that is needed to decarbonize the healthcare system. And there's also quite a bit of operational knowledge, technology, and supply chain infrastructure that needs to come online. And so I think the value of pledges is it starts moving things in that direction. I think there will be many institutions that are either not positioned to take those pledges or don't feel that they can do so for various reasons. And I think at some point, you probably will need some degree of incentives to move those institutions into the fold of sort of net zero sustainable healthcare. And that will take some time. And like any transition in healthcare, it will be complicated and there will need to be some funding mechanisms attached to it.
Great. So I'm going to pose the next question to Dr. Humphrey, which comes from Karen Fleury. Karen, thanks for joining us. The question is, was there outsized representation from emergency medicine docs? And if so, what do you think is the reason for the resonance between climate change and emergency medicine?
I think I can answer this in two parts. I guess speaking about those of us on the panel today, the reason it's a little lopsided is our fellowship at Harvard is for emergency medicine physicians working in climate and health. So that's our specific interest. On the ground in Egypt, absolutely representation from all manner of different specialties. So we certainly weren't overrepresented in that space at all. Certainly had other colleagues from other countries working in our specialty, but colleagues from every specialty you can think of: surgery, medicine, family medicine, allied health, everywhere. So it was really quite a diverse group of health professionals. In terms of how this resonates with us, I think I'd just like to pay a little bit of mention to that as emergency physicians. And one of the reasons I think that you may often see emergency physicians being very vocal in this space is the emergency department is the front door to the hospital. We treat everybody who comes, no matter what. We treat people who come from very complex and different socioeconomic backgrounds, who have poor social determinants of health, those who we know suffer disproportionately from the health impacts of climate change. So we are seeing how our patients suffer every single day in our clinical work. It's very, very real to us. And I think that's what spurs a lot of us to be involved in this space.
Thank you, Dr. Humphrey. We've had a series of questions now about youth engagement, and I want to raise a couple of those. The first is from Natalia Linos. Her question is, can you say anything about how youth were represented or absent, and whether the youth voice is relevant to the health and climate conversation? Dr. Wiskel, I'll give that one to you.
I think that it's incredibly relevant. And also, I think youth were actually very well represented and their voices were heard. I think I said this initially, but some of the strongest voices and the most energy were from the youth. And I think youth were also represented at a higher level, including the youth envoys, and they were able to bring their perspective to the larger sessions. In the closing session, there was, I believe, a 10-year-old talking about the impacts from Africa to the larger room. And that's something that needs to be there. And I think something that people talked a lot about because those voices are so impactful. And I hope that they're heard, and I hope they're brought up at higher levels too, like that.
Dr. Dresser or Dr. Humphrey, I'll let you chime in on that. There's actually another point, a question and a point here from Margaret McCandless, which called out the change in the voting age from New Zealand, where you can now vote when you're 16. And the question is, did COP feel like a place the young people are effective and heard?
Dr. Dresser, if you don't mind, I'll chip in for this one. Thank you. Oh, absolutely. So I think the youth pavilion at COP was the most vibrant, busiest pavilion out of all of the pavilions. And that's not only true for that pavilion. I think we saw youth everywhere. We saw them in high level discussion. We saw them being represented in all kinds of conversations at all. I think bringing it back to the point about the voting age is we have heard historically a lot of rhetoric around young people not understanding how things work, and therefore they shouldn't have a voice because they're not old enough to get it. I think they absolutely understand this. They understand the world that we are leaving them, and they understand what is going on far more than many people our age, I would say. So I think that youth voice is just incredibly important. And I think it really, at least to my ear and through my attendance, I felt like youth were everywhere, and it was inspiring, really.
Dr. Dresser, would you like to add, or should we go to the next question?
I think that covered it.
Okay. So the next question is from Kate Moretti on a different subject, which I'd like each of you to weigh in on. She asked, were there any questions from politicians specifically that you were unable to answer where information would be helpful to drive policy forward? I know several of you had conversations alluded to them with policymakers, and were they asking questions along these lines, or were there issues that came up where you realized that the health community actually needed to do more to understand what was going on to help get us to the ends we're seeking? Dr. Wiskel, do you want to start with that one?
Yeah, I think one of the big things that we can bring as health professionals is doing research that actually shows what the health outcomes are, and that we're able to bring back very specific numbers. And the Lancet report brings back some of this on air quality and what this is doing and how this is affecting lives. And I think we need more information like that, because when we can bring back those numbers and then show the impacts on health and then show the financial impacts as well, that's what's going to move the politicians forward.
Yep. Dr. Dresser.
I would completely echo that. I think the tendency in science is to do good science, right? You get the largest data set, the largest population you can work with, and you detect your discernible mortality impact from heat or your other health impact from some climate-related hazard. I think what we need now is a little bit of disaggregation, meaning we focus in on geographic units that correspond to political decision-making. And so if you're looking at policymakers, the science is largely there on here are the health impacts. They now want to know, what does this mean for my constituents? What does this mean for my country, for my state, for my city? And those answers vary enormously. Climate is having variety of different impacts all over the world on different populations in different socioeconomic contexts. And so I think applied research is really important for understanding what impacts look like in specific locations and also for developing solutions. And I think that is the point I would really emphasize here, is we need good evidence-based solutions where we understand the effectiveness and, where possible, the cost effectiveness of these solutions, because that's how you make a case for policy.
Thank you, Dr. Dresser. Dr. Humphrey?
Absolutely. And I will just echo exactly that as well. So I think the local context is so important. And when I've seen barriers in my work in Australia, it's largely been around the evidence not being from our local context. And so decision makers come back and say, well, yes, okay, that's great, but what does that mean for us? What does that mean for my community? So that local research is incredibly important, or taking research and making it relatable to the local context is just critical. Solutions as well are very important. There are a lot of good solutions. We know that there are some solutions. One of the big things about climate change traditionally is that people have seen it as something that they need to make sacrifices to combat. So you need to stop driving your car. You need to do those kind of things. You need to suffer to produce good climate action, when actually we know that there are so many co-benefits of climate action that make life better for people. And I think part of our job as physicians in this space is really to emphasize that it's not about making life harder, it's making life cleaner and healthier and greener for everybody as well.
Thank you all. Speaking of the local context, Dr. Humphrey, and to Dr. Wiskel and Dr. Dresser's points as well, we have a question from Barak Alamad, who points out that the next COP is going to be in Dubai, which has strong financial ties to the fossil fuel industry. And the question is, how can we use the next COP to influence states that are fossil fuel producing, particularly like the UAE and Qatar and Kuwait, et cetera, to move to a fossil fuel free future? And how does the health argument potentially play into that?
Absolutely.
Go ahead, Dr. Humphrey.
Yeah, so it is a challenge, obviously. We did have a little discussion when we were at COP around where COPs are held and how problematic it is if they're held in certain countries. To that, I would say for most countries, there are things that we could highlight that aren't great. It really jumps out at you when you're speaking about UAE, what is going on there with fossil fuels. I would say that we could flip that on its head to use that as a platform to have this discussion, really to highlight the importance of acting on this and how far some of these nations still have to go. In terms of the health argument, it really comes back to many of the things we've mentioned. We know the impacts of fossil fuels on health. We know the impacts of fossil fuels on climate change, but akin to that, we know the impacts of fossil fuels on respiratory health, aside from the impacts of climate change as well. So we know health as physicians. And so it's about bringing it back to that argument as well.
Dr. Wiskel.
I think one of the big things to make sure when we're holding COPs in petrostates, when we're having fossil fuel interests there, is to make sure that there's not a lot of greenwashing. And I think that's one of the big points that was raised at COP, was not making empty pledges or pledges that don't make sense, or talking about technologies that aren't really going to be helpful for making a healthier and cleaner environment. And I think our voices as physicians can be heard and acknowledge when something is or isn't greenwashing, or when it's really making a true pledge. And I think it's going to be incredibly important to do that, especially when a COP is held in Dubai in the UAE.
So it sounds like there's a critical need to have a large health presence at the next COP, and make sure that voices are. It does sound like the early indication is that there in fact is a welcoming there is a welcoming prospect for having a large health voice at the next COP. Dr. Dresser, what are your thoughts there? How do we address the reality of having a conference dedicated to addressing climate change in countries where the large proportion of fossil fuels are produced or even consumed?
Yeah, I think we speak our truth as we see it. We have a perspective as health professionals. We need to speak to our experience and to the impacts on our patients. And I think we all fully recognize the enormous strategic, ethical, and inequality implications of what that COP may look like. But I think we need to continue to speak our truth to those who will listen.
All right. So the next question gets a bit personal. So it comes from Sachit Balsari, whom I think you all know. Sachit asks, how did the COP discussions prompt each of you to change something about your professional or personal choices? Or did they? I'll start with you, Dr. Dresser.
Yeah, I mean, I think one thing I was very struck by, and there are a lot of challenges in this space, but I was very struck by how many people are involved and are coming from a very good place in their involvement. We got to interact with people from all over the world who are, as I alluded to in my previous response, speaking their truth. And those truths vary by location, their experiences vary, but there is a large community globally of people who are seeing impacts and want to stand up and do something about it. And I think that's very important. And the context of these negotiations is challenging. It's challenging every year. It's been challenging for decades, and it will continue to be challenging. But I think that the more that we have strong voices speaking to lived experience that is happening now, the more we can move the conversation towards recognizing and responding to the reality of climate change. And I think that, is something I was already involved in and working on, but I come back inspired by a lot of the people that I met and their commitment to working on this.
Thank you, Dr. Dresser. Dr. Wiskel, your thoughts on how the conversations affected your thoughts about how you do your job, your professional choices.
I think one of the things that I took from COP that I mentioned before was the interacting with people from a variety of different disciplines. And I want to bring that back to my work here at Harvard, from working outside just the health area and using all of the other institutions and great minds and bringing them together. It took going to COP to meet some of my colleagues from the US. And I think that's something that I want to bring back here and keep using in the future, both in the US, but also working with the colleagues I've met abroad now too.
Thank you. Dr. Humphrey?
Absolutely. And I think a few things. So number one is I, like a number of my colleagues working in this space, made I would say, significant personal choice to shift mainly from clinical work to working more in climate and health. And really being at COP and being part of all of that really re-energized me and demonstrated that we are making a difference and our voice does matter. There are so many of us now involved in this space, it can be a little overwhelming. So when we first got there, I found even the health presence at COP was huge, but there is space for all of us. And we all work in different ways and we all bring something different to the table. So really what I would take away from this is renewed enthusiasm and purpose that we are really making a difference. Dr. Wiskel and I spent a bit of time attending negotiations and being involved in those negotiations and really seeing how our health voice can influence that too, which was absolutely fantastic. And we can make such a difference.
Great. All right. The next question comes from Lori Garrett. Lori asked about the loss and damage agreement, which, as you've all acknowledged, is a new development in the history of these meetings, a long-awaited development in many minds. The loss and damage agreement has no dollar amount or target attached to it, and with the change in leadership in the U.S. House of Representatives, the likelihood that that body would approve millions, let alone billions of dollars to support non-American lives beyond what is routinely dispersed through organizations like USAID may not be as robust as one might think. What are your senses about how hopeful we can be about making good on this commitment to the potential of the existing and potential inequities associated with climate damages? Dr. Wiskel, do you want to chime in first on that one?
Sure. So I think she's absolutely right that there is a lot missing from this. And I do want to make a parallel to clinical work. So as emergency physicians, we might give a medicine and want to see the effects in seconds to minutes. And that effect can have a direct effect on our patients' lives. That's very different from the timeline involved in these negotiations and is different for me to process, where it can be years to see what the effects are. And I think just moving from where loss and damage wasn't even on the agenda to being able to get it on the agenda to then being able to have a fund is a big shift. And there were pledges made by certain countries that were in the millions, obviously nowhere near where it needs to be. But I think just having the fund there and is going to be the starting point. And it's not going to happen tomorrow. And we're all going to need to do work within our own communities and speak with our politicians. But it is the starting point for years of work to come.
Thank you, Dr. Wiskel. Dr. Humphrey or Dr. Dresser, would you like to add?
Absolutely. So I completely agree. I think loss and damage as a concept was first mentioned in 1991, which is an awful long time ago. It took 48 hours of negotiation and discussion to even get it on the agenda for this COP. And then we ended up with a fund, which I think we can't underestimate how important that is and the tone that sets for the future. Of course, the caveat that I would mention is in terms of the money for that fund, and as you identified, there is significant barriers now. So a lot of the commitments we saw from countries were previous pledges that were kind of reincorporated as loss and damage money. There needs to be about 200 billion in this fund by 2030 and $1 trillion by 2050 to really address all of the loss and damages that will occur. Right now, I find it really difficult to see how that might happen. But things can change, and this is a really important first step. So I think it is encouraging.
Thank you, Dr. Humphrey. Dr. Dresser?
Yeah, I would agree. I mean, I think we can see the glass is half full or the glass is half empty. And I think I constitutionally prefer to see the glass half full because that helps me stay motivated in my work. I think hope is an important piece of this. And so I choose to see this as a hopeful development, as both of my colleagues alluded to. If you had told me a month ago that this fund would even exist on paper, I would have been shocked. And so that's great. Now it exists. Next step, we need to figure out how we fund it. And I suspect, if the last few years have been conversation about Paris Agreement and trajectories and mitigation, this year was a focus on impacts and loss and damage. It may be that we need to move into a couple of years of really focusing on finance. And I think the US came into this with some ideas to start that conversation. Other countries came into it with other ideas. I think there will need to be further conversations around financing both mitigation and adaptation and also loss and damage. And as this question alludes to, that is a really complicated conversation, both globally and at the national political level.
All right, so I'm mindful that we're short on time. I'm going to give one more question from our terrific set of questions, and then I will give you each a lightning round to close with. But the final question comes from Kari Nadeau. And Kari asks a question which is really about the role of medical providers in this issue of climate change and health. She wants to know how you see the best and highest use of the medical provider voice, particularly in the setting of COP. Part of her question addressed how many MDs can we get in the door, which if you'd like to address, please go ahead. But I think her bigger question here is how can providers be more involved in policymaking to make a difference? Dr. Humphrey.
Thank you. So I think as a health professional, it's about finding where your voice is best suited. So it's not always about talking to patients. It's not always about talking to legislators. It might be about talking to your peers. It might be about talking to your community. I think those of us who are involved in this space find that we all have different skills and different ways that we can carry this conversation forwards, whether it be an advocate or really being involved in that policy space. In terms of how to get involved, I would say you can start small. So there's a lot of opportunities to join volunteer organizations, to be involved with sustainability in local health systems, to be involved in community organizations, to reach out to those who are working in this space to say, hey, I'm here and I want to be involved as well. And there is room for everybody and so much that we need to do. We need everyone at the table.
Thank you. Dr. Wiskel.
I agree that there's a lot of different ways to get involved because it's not easy to travel across the world and get a Blue Zone pass and get to COP. And we had incredible support from both the fellowship and from the Climate and Health Foundation. And I'm incredibly grateful for that support. But there's a lot of different ways to get involved as well, from speaking with your local politicians that have done before. And that's something you can do as well to go into these international events. And I think that finding the right place for you through research, through advocacy, through patient work, through education is the way to make your voice heard the best.
Thank you. Dr. Dresser.
Completely agree. I think you find where you can fit into this and what you find to be meaningful and effective where you are, and then you do that thing. My personal recommendation is to try to find a few other people to work with. Maybe that's colleagues at your healthcare institution. Maybe that's members of an advocacy organization. But find those people so you are part of a team so that you feel supported, because this work can be hard and it can be emotionally intense thinking about climate impacts. And so that you also have people to bounce ideas off of. And I think you will find as you get into the space that people are very supportive and that there's a lot of work to be done and we need your help.
So I want to thank all of our viewers for these excellent questions. I'm sorry I didn't have time to get to all of them, but we got to a good share of them. I want to give each of our panelists about 30 seconds to give a final comment about the climate and health space looking forward. We know that in a year, you three and maybe some others may be in Dubai. What are the issues from a climate and health standpoint that you see as emerging and relevant for the coming year? that we've got a whole host of folks watching, some of whom are in the press, some of whom are scholars, and a host of others. What are the issues that you see that are really important to focus on in the coming year, so that when we meet again next year in Dubai, we can make sure that we've already heard the importance of the health voice, that those issues are represented? Let me start with you, Dr. Dresser.
Yeah, I would say my takeaway is we need to get really good at telling the stories of these impacts on a human level. And part of that for healthcare providers means explaining your perspective. But I think we also need to be making an effort to elevate the voices of people, communities, patients that have been impacted by climate change. Because I think those individual stories are the single most powerful message we have about why it matters that we take steps to address ongoing carbon emissions and to set up funding structures and policies that will keep people safe.
Thank you, Dr. Dresser. Dr. Humphrey.
Thank you. So I think we know we can't have healthy people without a healthy planet. And I think we can very well identify this as our greatest health challenge, but it's also our greatest health opportunity as well. And I think in the coming year, one of the things that really energizes me is looking forward to those positive things that we can introduce into our communities, the co-benefits of climate change and the positive nature of what we're doing as well, I think is incredibly important. The thing that I'm probably most excited to for the next 12 months is really our cross-sectoral collaborations and how health is being integrated across all different areas, and the solutions that we will be able to come up with through working with others in this space who don't come from the health sector, I think is just incredibly promising, and it's a good future.
Thank you, Dr. Humphrey. And the last word goes to Dr. Wiskel.
Well, I'll agree with both Dr. Humphrey and Dr. Dresser. Let's bring in the collaborations, and let's bring in the individual voices, and let's also bring in the impact of the work we're doing. If it's your treating of different patients, or if it's what you've been able to implement at your own hospital, in your own community, you were able to plant some trees there, you were able to bring in air conditioning, you were able to do something. Let's bring what we're doing now to the greater community, to the next COP, and work with others to bring our patients' voices forward as well.
I want to thank each of our panelists. You all who are watching may not know people with medical degrees to be so amicable, but I think this is a good demonstration of that potential. I want to thank all of you who were here and participated in the webinar. I hope you found this on-the-ground perspective on climate and health from COP compelling. I would flag for you that we have another event on December 6th, where we'll be discussing a new set of resources that are focused on addressing risks to vulnerable communities through frontline health clinics. The link for that is in the chat. And with that, thanks so much for attending, and enjoy the rest of your afternoon.